We're going to jumpstart the last part of the morning with Dr. Sen, who's a critical care physician here at Mayo Clinic in Scottsdale to talk about critical care toxicology. So, Dr. Sen, welcome.
Okay, after some very core critical care, great talks in the morning, you're going to hear something maybe a little offbeat, and that's critical care toxicology. You do not have the slide deck, and you will get to see it after you finish this course. And I always like to kind of keep you all guessing, which is why I don't send it before. I'm just joking. So I do not have any financial disclosures. And so hopefully in the next 35, 40 minutes, I'm going to give you more of a case-based approach towards trying to figure out the latest and greatest in some of the common toxidromes and presentations that you may be taking care of in your ICU. Obviously, the world of toxicology is huge and immense. And I do feel that all fellows who go through critical care fellowship should spend a month rotating. I learned a lot when I did my rotations, and I think it really helps me, not just from taking care of patients who may have had environmental exposures and all, but really the meat and potatoes of what we see, that is iatrogenic toxicities and overdoses. So to start with, what do you do when you have a patient who you get called to see in the emergency department or on the floors, and you're trying to figure out what kind of toxic exposure it may be that you're actually asked to deal with? So the typical approach is, just like any other critically ill patient, go through a systematic approach through the steps that you've done in taking care of your deteriorating patient on the floor, the trauma patient, the neurosciences patient. The structure should always be the same, and that involves primary survey, A, B, C, D, E, D, E, F, G. Don't ever forget glucose, because a lot of these patients may have hypoglycemia. Ensure you take a good ample history, allergies, medications, past medical history, last meal, and their events, and then do a good secondary survey, a head-to-toe examination. And finally, think of toxidromes, what the manifestation of their signs and symptoms are that could actually guide you towards a certain kind of exposure that you may be taking care of. And to make it a lot more clearer, in toxicology, the important systems that get affected are mental status, pupils, EKG, their GI symptoms, and skin. The importance of a good history cannot be reinforced as much. Donald Rumsfeld conversation about known unknowns and unknown unknowns become very pertinent in the world of toxicology, because you always do not get the whole history. So take a good collateral history. What drug did you take? What did the patient take? How much? When was it taken? Why was it taken? What else was taken? Was there any meal associated with that? Those are critical masses of information that can help you decide what your approach has got to be. And then try and focus on the toxidromes.